Welcome, my dear friends. Myself, Professor Dr. Rajendra Raghuvir Deshpande from Pune, Maharashtra State, India, would like to welcome you all in my Ayurveda Academy YouTube channel. Now, you can see that we are running a series like a TV serial, Ayurveda in GP, that is Ayurveda in General Medical Practice. And we are today, we'll talk about the hypoglycemia. Hypo means less, and glycemia. Here you can see the Mia word is always related with the blood. Huh? So hypo means less. Glycem means carbohydrates or the glucose. When the blood sugar goes down below the normal level, it is called as a hypoglycemia. Normally, in the fasting condition, we have the 80 to 120 milligram percent. That is a normal blood sugar level. After eating the food, we have the level 80 to 140 milligram percent. Actually, this condition in the normal human being is automatically corrected by the nature itself. There is no necessary for any further complicated, what you can say, the management is needed. But this particular condition is very important when you are tackling with the diabetic patient. If you are at home, any diabetic patient is there, then I will request that this video is very, very important for you, because I request that in diabetic patient, especially diabetes mellitus, especially insulin dependent diabetes mellitus, or even non-insulin dependent diabetes mellitus, in both the categories, maturity onset diabetes, we have the fear of two things. Two complications are very common. One is a hyperglycemia and second is a hypoglycemia. But my words are very important now, that hypoglycemia is very, very more important and serious than the hyperglycemia. Because if the blood sugar goes below 80 milligram, like for example, 70 milligram, 60 milligram, 50 milligram, it drastically reduces your what you can say, the performance of the organs, especially the brain gets the less carbohydrates and the less glucose, and automatically the patient becomes unconscious. And if it is not urgently treated, that is the most important word, the patient can die. Remember my words. In hyperglycemia, there are little bit chances that we can save the life of the patient after admitting the hospital, and we will get the time, especially for example 8 hours, 10 hours, 24 hours, we have the time, we can manage the patient. But hypoglycemia, there are very little chances that if we very quickly any action not taken, then the patient will lost his life. So be careful. So because these are my personal experience with the patient as well as with my father. My father is fortunately running 91 this year, completed 91 year, and he is a diabetic patient, but he is a very sincere patient. I admit, I salute to him because of his pathya and very following his daily regimen and everything. So he is in a okay condition right now. But he had got a lot of times this hypoglycemic attack, and there we have to be very, very careful. For example, in this patient, when there is a blood sugar is less, basically why does it happen? Because many times, because of this reason or that reason, for example, if the patient is, my father is having some loose motion, then automatically says, Raju, my name is Rajendra, so I don't want to eat, and he don't eat for the whole day. And still, by chance, when he was taking insulin by himself, he was taking insulin or the tablets, and then that caused the hypoglycemia. So if the patient is not taking adequate food for the whole day, the person himself or the relatives or the attendants, whosoever is concerned, they should take care that anti-diabetic oral medicines or insulin should not be given when there is no adequate food in the stomach of the diabetic patients. Remember my words. Okay, so it can make a havoc. Second, you must identify whenever the patient feels little bit having a drowsy, not attending what you are saying, not doing his daily activities, like a calm and quiet sitting at one place, and intermittently like a sleepy condition. And when you ask him, Father, what you are having? Okay, not giving relevant answers, not responding to your commands, then it is, these are all the warning signs before he becomes unconscious. Otherwise, when he unconscious or is such condition of drowsy, immediately you have the glucometer. every house which has a diabetic patient must carry the glucometer at their home. Please, my request, although it is a little bit 500, 600 rupees, but keep glucometer at home. Learn how to check the blood glucose with the glucometer. Always learn. Patient himself, relatives, or the attendants, whoever they are, they should learn. Nurse, mama, whoever keep for is taking care, they must learn this technique of checking the glucose. And if they found the number below 80 milligram percent, immediately give him concentrated solution of glucon D powder. At the diabetic patient's house, there should be two things are very important. Number one is a glucometer, and number two, glucon D powder. Immediately take a glass of water, a little water and more sugar. Make a saturated solution of the glucose and try to sip by sip. You can just keep the spoon over here. If the patient is more and more drowsy and not able to engulf, then you can even rub that concentrated glucose solution. You rub on his tongue, then lips and gums. You just go on rubbing and hello, how are you responding? Then try to see the response. My dear friends, this is very interesting to note that if a little bit even glucose properly enters into his stomach, or even emergency, if you call the doctor, immediately he will give the IV dextrose solution. And the interesting thing that even if the patient is totally unconscious and within a few minutes, you can push the intravenous dextrose like a miracle. Understand my words, like a miracle, the patient gets up, gets full consciousness and full energy, and you will see that the patient is looking as if there is nothing was happened. Yes, nothing was happened. See the difference. He was unconscious, given the dextrose intravenous, and he gets up and gets the energy and absolutely following your commands, following doctor's commands and responding very nicely. There is you will feel, sir, you are saying that it is serious, it is serious. Arey bhaiya, jaan lo, try to understand. I am saying if it is not diagnosed immediately, and if it is not you orally, if you cannot give, or by chance if you make a late admission, then the patient will be gone with our hands. He will die, definitely. So be careful for the hypoglycemia. I will not discuss right now hyperglycemia, but hypoglycemia is a very, very serious condition. I will tell you very interesting thing. That means how to diagnose that. Drowsiness is okay, irrelevant talk is okay, but the most important, the profuse sweating, top to bottom, lot of sweating you will find with the patient. And that lot of sweating will happen in only two serious conditions. Number one, hypoglycemia, and second is heart attack. Remember my words. You can write down in your main diary of your home that Dr. Deshpande has told that profuse sweating in a senior adult person can indicate two dreadful diseases by which the patient can die. Number one is a hypoglycemia, and number two is a heart attack. So both are very serious. You have to call the ambulance and try to shift the patient. But meanwhile, in hypoglycemia, you try to rub some glucon D concentrated solution on the lips and the oral cavity. I think this background is enough. But now we will try to see what are the different types and what are the Ayurveda can give internally after coming out from the emergency. Okay, emergency only and only that you have to give the glucon D saturated solution or intravenous dextrose solution, 25%, 50%. Hypoglycemia is a symptom of early diabetes mellitus or complication. Most important is a complication for the treatment of diabetes mellitus with some oral hypoglycemic agents, or even with the insulin. Most common is with insulin. Then spontaneous hypoglycemia in a normal person when he's fasting too much, especially ladies patient, religious fasting and this fasting and that fasting, they may give a little bit fainting and weakness and tingling numbness of the hands. That orally they can give immediately some sweets, then they will regain their normal blood sugar. Now see the another causes, insulinomas. Insulin secreting beta cell, there will be adenoma of the islets of Langerhans. That is called as a true hyperinsulinism. lot of insulin is secreted, and that will absorb the blood sugar unnecessarily. Non-pancreatic tumors, mesenchymal tumors such as the fibrosarcoma, peritoneal myxedema, carcinoma of the liver, adrenal adenoma, and carcinoma means cancer, cancer of liver, cancer of cecum. This is something another causes than the diabetic patients. I have already discussed you the diabetic complication, which is 95% common. These are the some uncommon causes of 5%. Okay. Endocrinal diseases like adrenocortical insufficiency, that is idiopathic adrenal cortical atrophy. Adrenal gland is a suprarenal gland. Above the kidney, there is a endocrine gland which secretes the hormone. The destructive lesion like acute hemorrhagic fever, for example, dengue fever. Invasive neoplasm, that is a cancerous growth, is invading. Then adrenalectomy, adrenal gland is removed because of some problem. Then hypopituitarism, pituitary gland is in the brain, so there is a less function because of the tumor. Postpartum hemorrhage, that is related with the pregnancy. That means after delivery, if the lady is getting too much hemorrhage, that is postpartum hemorrhage with thrombosis and necrosis, that is Sheehan's disease. Very rare diseases. You may not think, if you are not a doctor, just neglect these things, because in the beginning I have given a full 5-10 minutes to describe the diabetic complication. Liver diseases, for the medical student, this is important to remember all these causes. Hepatitis, poisoning, cholangiolitis, and hepatoma. Toma is always a tumor. Cirrhosis of the liver for the alcoholic patients or the obese people. Glycogen storage disease. And then the functional, altered gastrointestinal function like reactive hypoglycemia following gastrectomy operation. Tomy means to cut. Gastroenterostomy, neurologic disturbances like anxiety, tremendous tensions are there, abrupt withdrawal of the prolonged corticoid, that is Visolon tablet or the prednisolone tablet. If you do not taper the steroid, that can cause the problem. So these are the steroids, and they should be, for example, one tablet 3 times in a day for 3 days, one tablet 2 times in a day for 2 days, one tablet OD for one. This is called as a tapering. So steroids must be tapered. Remember this. ACTH therapy, spontaneous adrenal failure associated with the fulminating infections. Infections are very common. Idiopathic spontaneous hypoglycemia in the infants, and physiological, that I have said, fasting and all these things. Pharmacological and pathological responses. Alcohol is the main cause. Sensitivity of fructose, glucose, and leucine following the starvation. Just now I have explained. Prolonged exercise, lactation, diarrhea, loose motions, and glycosuria, that is renal threshold. Because after 120, the kidney says that it is too much for me, and then it is get excreted. But if your renal threshold is low, then glycosuria means sugar in the urine. Okay. In investigations, immediately by glucometer, you have to check the blood sugar level. That is called as a random blood sugar level. Then hemogram and ESR to rule out the acute and chronic infections, because white blood cells are the soldiers, and normal count is 4 to 10,000 per cubic mm. If it is 15,000, mild infection, 20,000 per cubic mm, moderate infection, and above 25,000, it is a severe infection, maybe urinary tract infection, maybe because of the prostate and all any septic conditions in the body, like even the carious tooth. LFT to rule out the liver pathology, for example, fatty liver, etc. Hypoglycemia is a condition very important, especially for the diabetic patients. Remember my words, and who are on the medication, oral or the insulin. If the patient is showing the sign of hypoglycemia, give 3 to 4 teaspoons of concentrated glucon-D powder. IV dextrose 50%, 50 cc, 200 cc, or 25% glucose. Biscuits or the sugar cup, or the sharangodaka with sugar. That is something Ayurvedic formulation. Musta parpata ushira chandana nagarehi shrutam shitam jalam deyam pipasa churashantaye. So my dear friend, this was a little what you can say the important disease in our day-to-day life, because if you have any patient of diabetes in your house, please look this video and share to all your friends whoever have the diabetic patients at their home, and they should have the glucometer and glucon-D powder at their home to prevent the what you can say the serious any consequences. I wish you all the best. Thank you very much and see you in the next video. Till then, never forget to subscribe my YouTube channel and press the bell button icon to get the intimation of the next interesting video. Thank you very much and take care.